Hello, everybody, and thank you so much for joining us today. We're so happy to be able to bring you one of our Regional Policy Council webinars. And this is a really important topic: when equity meets policy, attacks, impacts, and pushback. I would like to begin today with a little bit of welcome. Jackie, will you move the slides for us? I don't think I have access to it. There we are at the beginning. And I want to begin by saying a little bit about who I am and how happy we are to have you here today. I'm Debbie Plotnick, and I'm Executive Vice President for State and Federal Advocacy at Mental Health America's National Office. And in my role, I have the wonderful opportunity of coordinating our Regional Policy Council. And I'll tell you more about that in a minute. But let's move to our next slide while I take care of some really important issues, like thanking our sponsors. It is so important. We couldn't do our meetings and coordinate all across our network and reach out to you today if we did not have the support of Alkermes, Janssen, Myriad Genetics, Neurocrine Biosciences, Otsuka, Pfizer, Sage Biogen, Synovian, the Takeda Lundbeck Alliance, and Teva. Let me do a little tiny bit more housekeeping with the next slide, please. So everybody always asks, and I'm happy to tell you up front, that we are recording today's webinar, and the recording and the slides will be available to everyone that registered in about a week. You'll be able to download them, listen again, and look at any slides. And very importantly, we would like this to be interactive. So please put all of your questions at any time as we go along in the chat box. And after we have our moderated discussion, we will get to your questions. We're very much looking forward to them. Next slide, please. So I'm going to tell you a little bit about Mental Health America's Regional Policy Council. So I'm hoping that you all know about MHA. MHA's been around since 1909. We're the country's oldest national organization for mental health advocacy and policy. And our Regional Policy Council is led by 4 of our best policy experts. And the Regional Policy Council coordinates our affiliates all across the country into clusters, and they share information, they organize advocacy, grassroots, grass tops. They keep each other informed about what's happening at the national level and the state's level, and bring that information to you. And one of our Regional Policy Council members is hosting today. Next slide, please. I want to tell you a little bit about our moderator for today, and that's Laura Evans. And we're so thrilled that Laura joined as one of our Regional Policy Council representatives last year. And she's the Director of National and State Policy at Vibrant Emotional Health. And she's very famous because she often hosts the Crisis Jam on Wednesdays that I hope that you'll all participate in. And we can put a link to that in the chat as well. And Laura is one of our 4 policy experts, as I mentioned, and the other 3 are Ben Harrington from the Mental Health Association of Southeastern Pennsylvania. Southeastern, I'll try that again. I used to be with Southeastern Pennsylvania. Ben is with the Mental Health Association of Southeastern Tennessee. Barb Johnston is one of our other members, and Barb is with the Mental Health Association in New Jersey. And Shauna Mulvihill is with our affiliate, Mental Health Minnesota. But today, everything is going back to Laura, who is moderating today's panel discussion. And I'll be back after we have this really wonderful in-depth conversation to moderate the questions that please, anytime, feel free to put them in the chat. Laura, take it away.
Thank you, Debbie, for that warm introduction. And thank you to MHA and the RPC sponsors for allowing this conversation. Again, I am the Director of National and State Policy within Vibrant Emotional Health, which you may be familiar with through our direct service programs in New York State, but you may also be familiar with Vibrant's national work at being the administrator of the 988 Suicide and Crisis Lifeline, as well as the Disaster Distress Helpline. So I'm very proud to have begun my policy career in the Ohio legislature, and I see there are many Ohio affiliates here today. I have the pleasure of introducing our esteemed panelists. I'm going to start with Shelby Rowe. Shelby is the Executive Director of the Suicide Prevention Resource Center, SPRC, at the University of Oklahoma Health Sciences Center. A leader in the suicide prevention field for the past 15 years, Shelby has a wealth of experience working at the local, tribal, state, and national level, most recently serving as the head of SPRC's Tribal Initiatives team and establishing SPRC's first Lived Experience Advisory Committee. An award-winning artist, mother of 3 sons, and a suicide attempt survivor, she is the recipient of the 2021 American Association of Suicidality Transforming Lived Experience Award and the 2016 Chickasaw Nation Dynamic Woman of the Year. Our next panelist is Tansy McNulty. Tansy was born and raised in Mississippi and currently resides in Las Vegas, Nevada as an active duty military spouse, boy mom, and founder of 1M4, aka 1 Million Madly Motivated Moms, an organization she founded in 2018 to unite Black moms to end police violence through legislative policy, education, financial assistance to impacted families, and encouraging Black youth to pursue roles in the legal system and politics with integrity. Tansy's background is in supply chain management with an expertise in logistics and procurement operations, but at her core, she's a problem solver who just simply wants to save lives and create a more equitable justice system. Our next panelist is Preston Mitchum, him. He's a Black queer attorney, advocate, activist, hailing from Dayton, Ohio, another Buckeye in the house, and currently living in Washington, D.C. He's the founder and CEO of PDM Consulting, a multi-purpose consulting firm focused on the power of Black people, LGBTQ people, and young people. In his 10 plus years of legal and policy experience, Preston has served in multiple roles at nonprofit organizations to center the voices of historically oppressed communities. He holds an LLM in law and government from American University, Washington College of Law, a JD from North Carolina Central University School of Law, and a BA in political science from Kent State University. And our final panelist is Jennifer Wang. She is the Senior Director of National Policy and Advocacy. She has more than a decade of policy and government affairs experience across a wide variety of social justice movements, including reproductive rights, health, consumer protections, racial justice, and immigrant rights, consistently delivering hard-fought wins to communities with socially imposed barriers to thriving. Most recently, she served as the Chief Strategic Partnerships and Research Officer for the National Asian Pacific American Women's Forum. Previously, she served as the organization's Deputy Director overseeing policy, legal, and communication strategies. She holds dual degrees in psychology and gender studies from UCLA and a JD from the University of Iowa College of Law. She's the proud daughter of immigrants and is based out of Washington, D.C. We have a very impressive panelist, lineup of panelists today. I'm glad that they are being a part of this conversation. I've just read some pretty impressive bios, and I wanted to start with having our panelists share some of the work they're leading. And Jennifer, since you were last, we'll start with you first. You could tell us about some of the work that you're leading at Fountain House.
I would love to. Thank you. I always have a bit of shyness when I hear my bio being read out loud. That's always an experience. So thank you so much for creating the space. We at Fountain House believe that we in the mental health infrastructure and movement cannot coerce, institutionalize, shelter, or jail our way out of the issue of mental illness in our country. Next slide. I won't spend too much time on this, but our mission at Fountain House is to create community, to innovate, to bring about social change by centering people who are most impacted by mental illness. We work specifically on people living by and for and with people living with serious mental illness so that they can thrive. Next slide. We are, I think, doing a great job of fulfilling our vision. We are seeking to transform the way that the US and the world sees and treats people most impacted by mental illness. We take it seriously in our communications work. We see ourselves as stigma busters. We see ourselves as members of the broader mental health community that is really demanding dignity and taking up space in the name of dignity. We are shattering barriers to community by directly talking about the problem of loneliness and social isolation. And we are moving from focus on the individual to community and societal impact. Next slide. We believe, and I think this is important, we believe that everyone is capable of great things. We believe that everyone has access, should have access, and deserves just an equitable treatment. I want to highlight the word equitable here in our values. And we believe that everyone has the right to self-determination and community. Next slide. I'm going to be super brief here. I just want to make the point that Fountain House was founded more than 75 years ago by people living with serious mental illness. This group of our founders were people who were recently released from Rockland State Hospital, and they were all people living with SMI, and they were casually meeting on the steps of the New York Public Library because they were, really discharged without any strategies or any programming or any community care to mitigate the negative symptomology that they were dealing with. And often people living with serious mental illness need more than medication and therapy. Oftentimes they need other strategies like community-focused mental health care, like therapeutic environments that really center their strengths and really encourage the building of community as the therapy itself to mitigate loneliness and social isolation. And so they came together, they founded Fountain House. We are the first of more than 200 clubhouses nationwide and more than 300 clubhouses internationally. And so the Fountain House Clubhouse model has been replicated in more than 40 states and more than 30 countries. And we see ourselves as not only, an organization that centers people living with serious mental illness, they are at our core, not just today in the therapeutic environment that we create, but also they were central to our founding. We wouldn't be an organization. We wouldn't have this model without our founders, all of whom were people directly affected with lived experience and with vision and a great vision to create the organization and model that they created. Next slide. So just this presentation was actually co-created by our members, all of whom have serious mental illness. We created this presentation in collaboration with them. And these are stats that they felt policymakers should see. And I bring them to you all because this is the way that our members actually believe in conveying the issue. So I think these won't come as surprising to anyone, but people living with serious mental illness are 2.5 times more likely to experience housing instability or homelessness. They're 3.5 times more likely to be incarcerated or to have some justice involvement. They have 5 times the rate of unemployment. And of course, in the community that we work in, which is New York City, we have 2 clubhouses in New York City. 16 out of 19 of the people with mental illness killed by the NYPD since 2015 were people of color. 2 to 4 times more likely to die from unnatural causes such as suicide or homicide. The life expectancy of people living with serious mental illness is 10 to 25 years shorter than the general population. Next slide. We have 2 clubhouses, one's in Hell's Kitchen and one is in the Bronx. We were very intentional in starting our Bronx clubhouse because our membership there is 90% BIPOC, which matches the broader environment of the Bronx. In the Bronx, 91% of residents who are Medicaid eligible live in the mental health desert that is the Bronx. And the majority of them are Black and brown and low income. And so we see ourselves as a real force and are intentionally creating community in communities that have been long ignored, which we think is a good strategy for an equity-focused organization. Next slide. I'm not going to talk too much about this slide other than just to make the point that our work by, for, and with people living with serious mental illness is intentionally intersectional, right? With the knowledge and understanding that if we don't address things like housing instability, if we don't openly talk about race, if we don't openly talk about disability, if we ignore employment rates, if we look only at averages and not at outliers, we are essentially not doing justice and not serving our community right. So our work is grounded in the lived experience of the people living today with serious mental illness, and they tell us how intersectional their lives are, and they tell us how with self-determination and agency what their needs are. Next slide. We've got some ongoing external strategies. We also have some ongoing internal strategies. So breaking stigma is a core part of our work, especially because we work with the SMI population. And I think we're constantly asking the question, right? Like, who do we center when we stigma bust? The choices that you make when you are thinking about storytelling campaigns, when you're thinking about who to provide the opportunity and to create the space with policymakers, like who those people actually are, is an incredibly important conversation. We're also committed to becoming an anti-racist organization. And I use the word becoming because we don't believe we've become one yet. It's an ongoing, the work is ongoing, and you don't just arrive, right? And that idea is supported by our leadership, but it's also, I think most importantly, has had grassroots support from our membership. And our real goal is to co-create that change and to co-create anti-racist programming, as opposed to just, from the top down saying, this is what we're doing and here's how we're going to be anti-racist. Because our members are people who experience racism. They are people who experience sexism. They are people who experience ableism. And so they are the experts in telling us the strategies that they want to focus on. Next slide. Okay, that's the end. That's my long-winded answer to your first question, Laura. Thank you for the time in this space.
No, Jennifer, that is so helpful because Fountain House is doing so much and that clubhouse model is so important. Thank you for sharing that with us. Preston, can you tell us a little bit about some of the work that you are doing, and then we'll just go backwards from the introductions.
Yeah, I would be happy to, especially because PM Consulting LLC is my baby that's recently started in 2023. So thank you for the opportunity to speak with everyone today. And thank you for the invitation to Mental Health America. So I really want to start off by just honoring and saying rest in peace to Harry Belafonte, who died not too long ago. For those who really don't know, I think it's quite fitting to honor him at this moment, but also to recognize a lot of the work that he did in a variety of areas, especially racial justice. A lot of the songs that he sang about were clearly rooted in activism and clearly rooted in what I consider, and obviously what Byron Rustin named angelic troublemaking. So just really wanted to start my remarks off with really an honor to Harry Belafonte. So as alluded to earlier, in my over 10 years of experience in multiple movements as an attorney and policy professional, including racial, reproductive, gender, and LGBTQ plus justice, I am particularly grateful to have the opportunity to own and operate my own consulting company, PDM Consulting LLC. To describe it a little bit, it really is a multi-purpose Black, queer owned and operated consulting firm that's centered on the power of three communities. And to Jennifer's point, certainly communities that share identities and experiences. And it's really on the power of progress of Black people, LGBTQ plus individuals, and young folks. For me and for us, we deeply believe that sustainable social change requires the active participation and engagement of those affected by these named social problems. And so I really appreciate every time I hear Jennifer speak. For those who don't know, we've known each other for years because of our work in Repro. But I really do love every time I hear folks and businesses discuss the ways in which they have folks who are impacted and affected by social problems being centered in doing the work and providing the solutions by which they do the work. We focus largely on three areas. So that's policy and advocacy, strategy and solutions, culture and change management, and justice, equity, diversity, and inclusion audits. And I usually use JEDI as an example more than DEI, because DEI in and of itself doesn't mean you're going to get justice-centered results. And so, for me, at least, it's really important to lead with justice as a through line that leads the work of hopefully finding solutions related to diversity, equity, and inclusion. In terms of policy and advocacy, strategy, and solutions, for us, it's quite clear that we really want to help organizations and individuals achieve their goals through strategic campaigns and effective policy development. So not necessarily just the legislative win, just the legislative aspect. Of course, that can be a win, but as I'm sure we're going to discuss today, we see that sometimes what is a legislative win always ebbs and flows depending on who makes up the legislation. So, or the legislative session, or the members of Congress, state lawmakers, among others. And so we frame it really around the advocacy campaigns itself, because that provides flexibility and wiggle room through thinking of how you power map folks. So who is your bedfellows? Who are the people who you've never worked with, who you may want to work with? Who are the people who you may need to receive power from, but may not want to relinquish it? And those things can really be accomplished in terms of an advocacy strategy and policy development analysis. And again, going back to really the mission, right, at the core, effective policy and advocacy requires an understanding of not only the social context that you're in, but the political context, which so often is deeply intertwined with the social context. The last thing I'll just offer here is also in terms of culture and change management. We always hear about, right, positive company culture. What we really oftentimes don't hear about is who's shaping the reality of what it means to have an alleged positive company culture. And so there are many folks who believe, right, that a company culture doesn't have to be positive, right? It has to be justice-centered. It has to be something that is rational and relatable to those who are mid and junior level staff. And obviously, I can talk for years about toxic positivity and who obviously does not get the gentle nature of being the quote unquote positive one in the workplace. A lot of those company policies, quite frankly, are anti-Black, but are deeply rooted in respectability to politics and white supremacist ideology. So a lot of this is really in terms of how do we make sure that a culture and change management is really centered in equitable responses and not this supposed belief of how we should show up in a workplace. And then, of course, JEDI. Is your company doing well? Do they believe that they actually are race forward and discuss things that are actually more explicit in terms of sexual orientation, gender identity, and race and racism, among other things, of course. And so all that to be said, a lot of the work that we're really leading has been focusing on working on legislative and administrative policies to close gaps in healthcare coverage for those who are experiencing serious mental illnesses and those who may need other gaps in coverage that their insurance is not fully applying to. Of course, JEDI work and comprehensive solutions to discriminatory practices and reviews and evaluations of government policies. I could talk about this for forever, so I'll be quiet and let the next person go.
Perfect. Thank you, Preston. Tansy, do you want to tell us a little bit about some of the work you're leading?
Sure. Thank you all for having me. MHA, thanks for having me. Vibrant. Pleasure to be here. So my name is Tansy McNulty. I am the founder, as she mentioned, of 1M4, which stands for 1 Million Madly Motivated Moms. And our goals as an organization is simple yet complex. It is to end police violence in this country by the year 2038. And you probably hear that like, girl, no, you're not gonna be like, I get it. I get it. It sounds like a BHAG, right? It is. When you break a huge problem into small little sections, it gets a little bit more attainable. So we're in this space, in the mental health space, because a couple of years ago, 2021 to be exact, my organization rallied together to say, I know we're trying to fight for justice and accountability, but how do we get in front of this where we're preventing the interactions in the first place? So me and our organization, we got on the phone, got on our social media, we got on emails, and we found as many alternatives to police response as we could for mental health emergencies. Why do we do this? We did it because of Elijah McClain. He's the person we were discussing at the time during the meeting, and he's the name and the face that popped up. We wanted to know, what can we do to make sure that Elijah McClain's mother is not duplicated multiple times for generations to come? So we got on our phones. We started out with about 34 units, actually exactly 34 units across the nation. And by the end of that iteration, we found over 150 alternatives to police response. Now that's both true mobile crisis response, those who are clinicians and community response teams, and co-response. Now at that time, we had to include co-response because there were not enough community response teams out there. We later learned that co-response is not our preference. As an organization, we want mental health and mental illness to be decriminalized, period, meaning no police response. But we included those because it was just so sparse across the country. So that's why we're here. We're here to make sure that we not only advocate for more funding for community responders and community response teams, but also that we really humanize what mental health and mental illness is. Because whether you have a serious mental illness or not, you are absolutely connected to someone who does. We want to make it normalized, destigmatized, and absolutely decriminalized, particularly for the Black people, because when you're Black and you have a mental illness, it gets a lot more dangerous out here. So that's who we are in a nutshell. And we're just happy to be here. Nice to meet you all.
Thank you, Tansy. Shelby, will you tell us a little bit about the work that you're leading at SPRC?
Sure, happy to do that. The Suicide Prevention Resource Center, for those of you who are not familiar with us, we are the only federally funded resource center that's devoted to advancing the implementation of the National Strategy for Suicide Prevention. We are supported through a grant from the U.S. Department of Mental Health and Substance Abuse Services through SAMHSA. Quick disclaimer, today my thoughts and views may not necessarily reflect those of my funder. I am here as Shelby Rowe, productive complainer, as I would say. But SPRC, our project that I lead, we build capacity and infrastructure for effective suicide prevention. We do that through consultation, training, resources that we provide for states, tribes, healthcare systems, community systems, professionals, education programs, national, public, and private partners. So really anyone who's working on suicide prevention, we are here to help them do that better. It's important to us that whenever decisions are being made. So I think with that in my bio, my scope on policy is a little different, and that we help people implement things. And, recently, one of the recent projects would be 988. And with that, the commitment at the federal level is this is a service for all Americans. And when we look at that, that is also that commitment to build a system that is for all Americans. And so we have played a big role, we being my team at SPRC and our advisors, of making sure that when decisions are made, policies, trainings getting developed for call centers, of making sure and checking, is this service safe for, the child of immigrants in California? Is this service safe for, a Black trans 15-year-old girl Is it safe for tribal citizens? Is it safe for those hard of hearing? Is it safe for everyone? And looking, and then asking, making sure that when we're determining that we are letting individuals in those communities tell us if they feel that it is safe. And so we do work with trying to listen, bring voices to the table, advocate for those individuals so that system can be built out well. So we've been working, there's a lot of stuff happening as far as doing some real research and funding and investing in working with target populations of individuals who may be reluctant to call for help. And those populations sometimes get surprising because not only is it Black teens, Native teens, LGBT, but it's also rural men over 50 who don't call because they don't believe that help is there. And so of looking at and advocating. And so I think some of that when we're looking at equity and inclusivity, that sometimes we look at who are those groups that are marginalized when it comes to mental health and suicide prevention. There's a lot of common ground that we can leverage. I think there's still a lot of opportunity to leverage because a good mental health clinic in rural America is going to benefit everyone there. So things that we look at as race issues, sexual orientation, gender, in this politically charged climate, they're human issues, they're American issues. And so trying to find those services that make these national promises that they do benefit all Americans.
Thank you for that, Shelby. And I just want to thank my entire panel here. You all raised a lot of points around why it's so important to have equity and the different populations that may be affected or marginalized. I want to put this question out here for everyone. So feel free to hop in the discussion, and please, audience, you can follow along and add to the chat as well. But this topic is so popular right now. It's so hot in the media, but no one can quite seem to define what they're talking about, right? When we talk about equity, some people say, well, this is a woke agenda without defining what woke is and what that means. So I'm going to put this out to the panel here. What does equity and policy mean to you, and why are we seeing this backlash towards equitable policies? Any takers?
I mean, I can try. And I'll be brief here because I feel like the other panelists will have a lot to say about this. But I think one of the main reasons we have backlash is white supremacist culture or white supremacy culture, right? I think oftentimes the people who are opposing equitable policies are engaging in either or thinking like, okay, well, if that's the case, then I'm going to lose something, or scarcity mindset. I think a lot of the opposition is rooted in just pure defensiveness. Sometimes I think it's rooted in power hoarding, right? Like, I as a person don't want to give up the small amount of power I have to a person that might have less power. And I think sometimes equitable policies feel threatening to people who, whether consciously or not, are engaging in white supremacy culture. And I think that's important to name. And I think that doesn't necessarily mean that people who engage in the culture are bad people. I just think that it's oftentimes, I think, just very, very easy to preserve norms. And I think it's easy to feel resistant to change. Resistance to change, I think, is very commonplace. But I think, some of the language that we have now makes it a bit safer or a little bit easier for those of us to point out, maybe it is white supremacy culture at work. Maybe this is either or thinking. Maybe this is scarcity.
Yeah. So the word woke is very triggering for me. I will be very completely honest. It's triggering because it's now being seen as this negative thing, right? It's demonized, weaponized. Oh my goodness, woke supremacy is even a thing. I'm like, it's a lot. And for me, woke is or being awakened to understanding what's happening to someone outside of yourself. It's literally being aware, educated, aware, and knowledgeable of what's happening outside of yourself. And I'll share a just really short example of just this past Friday night. I got a phone call, text message about midnight Eastern time. And a friend of mine had a friend who was at a hospital. She was in the ER in the bathroom having a severe panic attack. She could barely move. She got enough to text her friend, who then texts me because I know about mental health response. And she's in the ER, like in the bathroom, because ER recipient, the people there just ignored her. And she's a young black woman. And someone finally came into the bathroom to help her. And you know what I said? I hope it's a white woman. Because I know they'll start moving if she starts to complain. And then I had to stop myself, like, why did you say that it had to be a white woman to come help her? Because she would get a response. It's because I know what persona typically can get more of a response out of staff, out of legislators, out of people. And to me, equity is that Black woman going in the ER where she should have been in the ER and them saying, what's going on? Let me help you, versus saying, girl, sit down. You're just upset, relax. No, she was having a severe panic attack. And I was happy that her friend knew me to contact. But the problem is that everyone doesn't have a friend they can contact at midnight. And that's where the problem lies for me when it comes to equities. Everyone should be able to go somewhere or have policy that aligns with getting me the help I need, not based on what I look like, who I love, where I live. There's the fact that I'm a person that I need help. So am I woke? I am super woke. I am awakened, whether it's happening to me or someone else. I am wide awake. And I hope everybody else is too. But yeah, that's my 2 cents on woke. And I hope that answered the question and didn't trigger too many people.
Yeah, I love that because I am very proud to be woke all the time, even if it's a negative connotation that people are drawing with it. Because the reality is that, you need some folks in this world to be woke and trigger responses that make people move to action. So, it's just very interesting. So I really appreciate these first 2 comments. I will say equity to me is quite simple in terms of a definition, but difficult as a practice unless individuals are first dedicated to advancing the rights of historically oppressed folks, right? Even before we get to to systems, right? Like we have these individuals who proclaim to make up the system, but many times the individuals actually push back on equitable responses, but then blame the systems. And so that's a very interesting dynamic. But I'll just say, to define it, equity refers to like fairness and justice, and is distinguished from equality. So I always think it's important to know that equality it's not a horrible thing, right? It's a good thing. It's a start. Equality is really getting people what they all deserve, and whereas equity is getting people what they need and deserve. So just think about it, right? If we are thinking about equality in a nutshell, it's getting everyone the same thing. But since people have experienced years, right, of obviously many things, anti-Black racism, colonialism, stolen land, among other things, if you get everyone the same exact thing, it still inherently means things are unequal because everyone doesn't need the same thing. There are many communities for a millennia that has never received even the same things ever. And so they're always going to be behind if we're just worried about what equal looks like. Equity, when we think about it more, right, it's really about how do you actually, in many ways, give people more to make adjustments to the power imbalances, to the systemic imbalances that have taken place for forever, quite frankly. And so, to give an analogy, I always give an analogy to the repro movement here. Equity in policy is abortion access, whereas equality is abortion rights, right? You need rights, but rights don't inherently get you access, but access will always get you rights. So you really need equity always more than equality. And so that's just the way I always look at equity and equality and really in policy and in practice. And I can talk for a long time. So I do want to say, or at least put additional comments in the chat. A lot of this is happening for historical reasons, right? And it's very intentional why this is happening. I want to be clear when we're discussing wokeness and what that means, because this is not the first time we're seeing backlash. If folks remember during the Obama administration, when folks had even thought of Obama proposing something that was more progressive, and the immediate reticence or sometimes the visceral reactions, people started to call it a blacklash, meaning that they were not only worried about the message that Obama was espousing, but really the messenger of him being a Black person, even if it was something that benefited them. It was the exact same reason, quite frankly, that we saw time and again, people hate Obamacare, but love the Affordable Care Act. What was people focused on were, and spoiler alert, it was the same thing, just in case people may not understand why that's ironic. And so, right, it's really important that when we're seeing this backlash, we're seeing it happen in a concerted way that does attach or link the white Christian evangelical movement that has obviously been happening for a while, white supremacist ideology that's been obviously happening for a while, in addition to other things, right? It's why we've seen anti-LGBTQ bills go from 41 in 2018 to more than 400 this year. It's only been 5 years, right? And it's a coordinated, funded attack. And so the backlash doesn't surprise me, but to the points made earlier, backlash happens when people who've always been privileged believe that other people are also now receiving advancements, right? That actual aligning, so to speak, starts to feel like oppression as opposed to an equal playing field.
I mean, everyone else handled it so well. So thank you. You all made it easy for me to kind of chime into the conversation. And I think, of all of the gems, and one I love, what Preston just said. And I think for those that have had, something that a lot of us have heard, but if you haven't heard, those that are used to privilege, equity and equality feels like oppression. Because it is seen as an either or, because in our system, and I think that unpacking, we have to name it, as the white supremacy model, but in that everyone struggles and suffers in that colonial mindset, not just oppressed population. The majority population suffers too on that, because it is a scarcity oppression mindset. And so stepping back away from that everyone can have equal opportunity to succeed. When we look at social determinants of health, in suicide prevention, there are complex risk factors, and no one is immune. And so looking at that of your social determinants and political determinants, some individuals, we saw, even though some of those that we go, oh, well, these people have everything going for them. As someone who works on suicide prevention and just as a mom, I was mortified if you remember when Michael Jackson's daughter, was taken to the hospital experiencing a mental health crisis. And this is national news. And it's like, this poor child cannot receive the health care that she deserves without the backlash and public statement. And so for that, that's a determinant of health. And so on different levels, and I just, woke is triggering for me too, Tansy, because it's with trying to create an inclusive society that, in public health a while back, a lot of us were striving for that. And so it's just kind of like, why is this all of a sudden a bad thing to create safe spaces for everyone? That it's just been politically hijacked and is causing irreparable harm, most specifically right now in trans communities, when it comes to mental health and other things. So I think on that of just hoping that, it is irreparable for the lives right now. I am cautiously optimistic that this backlash, that the pendulum will swing back to inclusivity. But in the meantime, at what cost to lives, to families that say, I can't ask for help right now. And so I think with that, and again, disclaimer, I'm here representing myself, not my employer and certainly not my funder. But yes, and seeing, in tribal communities, one of the examples that we have is just urban versus rural. And it is kind of, on one hand, being told it's too complex to help, wow, everything's too complex. And it's like, well, of course it's complex. It was set up that way in the federal government. It wasn't our choice to have 574 separate treaties with separate rules and requirements. But, it's like, oh, well, we can't serve them because it's too complicated, or we can't serve because too rural, too remote, even though, over 70% of tribal citizens live in urban areas and but just refusing to serve. So we could all talk all day, which is why we're here, why Laura picked us. But I am hopeful. I am cautiously optimistic that backlash, that it will settle back down, because, and partly maybe it's naive, but there are just so many good people, I think, working in the field. And growing up in Oklahoma, one thing is that there are more stupid people than cruel people. And I have to remind myself of that I think people want to get it right, but there's just a lot of political noise right now that's keeping that from happening, that's really getting in the way. No one wants their children killed by police. Everyone wants children in the community to be safe, but we've got politics and policies and systemic racism and oppression that are preventing that from happening. So getting back to looking and having policies and practices that do not purposefully harm families and systems.
I want to thank you for that, Shelby, and I want to thank you all, because I'm going to pull something from everyone here and incorporate what I'm seeing in the chat as well. I think you all have touched on what we're seeing happening at a federal and state level. Preston, you mentioned the increase in anti-LGBTQ plus bills. Tansy, you mentioned how it's not safe for Black and Brown and other communities to have a police response. And Shelby, what you just shared, I think adds on to that. And as we talk about this language of why there's this pushback against equality and equity, sometimes feels like we're talking a different language, right? It was noted in the chat that saying white supremacy can scare legislators who are in control and power. What do you all say to individuals on this conversation, on this webinar, of how we can help push back? How can we have hope and effectively organize against some of this when we're not even using the same language?
This may be a hot take, but hey, I'm gonna say it. I think it will always depend on who the legislator is, right? Always. I think you do, whatever wins look like, you do have to shift your language over time to meet the needs, again, depending on who the legislator is. But I oftentimes believe that legislators know exactly what this language means. It's how they actually manipulate and abuse it. You have to first know what it is to be able to abuse it and use it in a ways that suits you and your interest. And so, I'll even gently push back on this idea that legislators are are afraid, so to speak, of the words white supremacy. I don't believe that's true. I believe that they don't want to be considered a white supremacist, but they absolutely fully know what white supremacy culture means and what it is. And so I wouldn't give them that much grace. And I oftentimes think that when we're giving, the thing I oftentimes have said is that I understand the need in many ways just because of the structure of policy incrementalism, but it's also hard for me to celebrate these alleged wins, one, when a lot of times community aren't involved in the conversation of what a win is in the first place. And then two, people are dying while many of us are celebrating these alleged wins. And so, it's really tricky for me because I do believe that language matters. Language shapes a lot of discourse, obviously. Malcolm X talks a lot about language and media and who actually is the villain and the hero, depending on who wins or loses, air quotes intended. But I really do want to give space to this idea that we have the power, right? Like when COVID happening, when there was an uptick of COVID is obviously still very real. But in the height of COVID, there were mutual aid programs created. Right, we were responding faster than legislatures ever could or did or wanted to. And so I think we give a lot more power to policymakers and not enough power to community who actually are the ones who shape our lived experience every day.
Yeah, what did you
Yeah.
call that, Shelby? The productive complainers? I like that, and I like what you just said. Tansy, I see you've come off mute.
Yeah, I was just thinking about what Preston just said about, 'cause I struggle with the language conversation, how to sometimes soften my language or, say things to get more people in the room, more people listening before their guard goes up. But it's absolutely right. A lot of the solutions come right from the community. Not saying that we don't have to work with legislators, right? You have to have conversations with them, but particularly when it comes to mental health response, that's some of the most caring, care-centered response teams are not people who have all these letters behind their name. They're people who come from the community. And I was just on a call a couple weeks ago with a foundation who had put up this new report about, what does the nation think safety or safety response should look like? And overwhelmingly, the nation doesn't understand what a non-police response would look like for certain things. Like, who would come? I'm like, well, there are a lot of other people in the world who could possibly come help you. But what does that mean? You have to really truly paint the picture for people sometimes. And speak what Preston said about, narrative, making sure that we as people who understand that there are more equitable options, better options, safer options for mental health and illness, we have to make sure that we're sharing sharing funding and amplifying those things. Go back to the funding, fund them. Community response, fund them, give them the funding. They're already doing the work. They just don't have necessarily the money to do it at a large scale. And there are now commissions coming out, expanding first response, expanding all these other, looking at things more holistically. But we've really got to center some of these community response teams and just empowering one another, which all of us on this call, to do what we can do to bring these solutions to fruition too, not just blame it on people who are sitting in certain purchased positions. Those positions are purchased, whether they want to say it or not. So that's my 2 cents.
I just want to give a shameless plug for our hosts, because I don't know if they can, MHA all across the country does a great job of doing this work at the local level, because, all politics starts in the community. And MHA everywhere I have experienced in different communities I've lived in, the staff, the teams, working to create that dignity, respect, equity, protecting individuals. I think it starts there. It starts with how we treat, everyone in our community, especially our vulnerable populations. And so just commending, we're highlighting the issues. And I know you've got questions for us, but I just wanted to brag, on our hosts for this panel, that MHA is making a difference and is a good part of the solution to this issue.
Thank you, Shelby. And thank you all. I'm going to get to questions in a minute. I'm back to do that, but I want to thank you for that. And we very seriously consider what we say and how we say it. And as a person that interacts with legislators all across the country, in states and in the federal government, I'm always cognizant of my white privilege. I'm also cognizant of what we're seeing that is coming directed at many communities in the way of hate. I will tell you honestly that I feel it acutely too, as a Jewish person. We got so much to go around that we're all sharing it at this moment. But that's to the point of why we must stop it. And we must recognize how important our language is. And we do have to speak differently. And it's really hard sometimes to speak differently to legislators who come out with things that make us sometimes cringe, but often we can find that humanity, find that connection in there and help people see that very often, and relevant to this conversation, is that their language and their actions is very hurtful to people, and that their families and their communities, even if they themselves are not impacted, their families and communities are. So really, really important. We've got just a couple of minutes here, and we've had questions that come from all over the place, but a lot of them really have to do with 988, with follow-up, and with not having police response. And this is something that I work on very importantly. And I often work with groups that represent co-responders and police, and they themselves will say, we don't belong here. And it's not that they don't want to do the work and they don't want to help people, they realize they don't belong here. So what are some more of the things that we're seeing that we're having response that is not police response? And how does it look different in different communities?
So I will address that one after collecting so many. So they truly look different in most communities, whether it's a clinician, a medic, a firefighter, medic. Like there's so many different combinations of people, or just a community member who just cares and can have conversation with two people who are disagreeing, or someone who's having an episode. They can say, hey, do you feel safe? Are you okay? What do you need right now? It looks so different based on the need of the community and the need of the response team and their capabilities. On our guide, we have, like I said, about 150 across the country. If you've seen any type of mobile response or community response, they've probably either seen our site or referenced it at some point. It's been out there now for a couple of years, but it really can be made up of any combination of people. But the root and the core, you have to care about who you're responding to. No matter what your title is or what you do, what your professional nature is, wherever you're responding to, you have to care. And there are a lot of caring people out there. They may not know that they can form their own response team or get the funding to do this type of public safety work, because this is public safety work. It's keeping the community safe. And I don't necessarily ever say, policing is public safety. It's different. Those are different things for me. But responding to the community's needs, whether it's mental health or disagreements, that's public safety work. And it can look like any combination of groups of people that I mentioned before. I hope that answers their questions.
Yeah, just to add to that, our members actually released a plan, a crisis response plan this morning for New York City. And this is people living with serious mental illness who have told the community that they want a peer or mental health professional they can speak to within seconds instead of minutes. They want a mental health response team that can come to them within minutes instead of hours, day or night. They want access to short-term respite. They want real ongoing support in the community after a crisis. They want smoother integration into social services. And the big thing they want is increased trust and, peer oversight. And so, I think it's important to understand that these solutions not only can be crafted by people living with serious mental illness, but are often pretty transformative when they are crafted and co-created with people living with serious mental illness. And I think that's a big part of our organization's role. I put the link to the report in the chat, and if anyone wants to join our campaign, the link is also there. I'll repost it.
Thank you, Jennifer, for putting that. I can't wait to read it. We're out of time here, but we would really welcome doing a reprieve of this conversation and continuing it another time. I really want to thank everybody that has been with us. I want to again thank our sponsors, really important. You can see all their names there, and I want to invite you to, next slide, please, to join us at following us on all of these important things, but join us for some of our upcoming things. Our Mental Health America National Conference is free if you join us virtually, and we'd love to have you join us virtually. The Regional Policy Council has more meetings and more webinars this year, and it's really important for us to hear from you and to tell us what you think about conversations such as today's conversation. Your attendance and your feedback is very much appreciated. And Laura, we thank you so much for pulling together the panel and moderating. And thank you so much to our panelists, to Tansy and Preston and Shelby and Jennifer. And we hope that you'll all follow us at Mental Health America and join us for more events. So thank you again.